Hi, my name is Rachel. I've been working at Leeds Teaching Hospitals Trust for around 3 years now. I'm a clinical support worker and I work on J93, which is oncology. My role on the ward is assisting patients with anything that they need and assisting the qualified nursing staff. We want to make sure that the patient has the best experience possible whilst they're in hospital. The patient is at the centre of everything we do. Their safety, comfort and well-being is a main priority. The challenging part of the role can be the shifts. You can be on days 1 minute starting early and then nights the next. There's also a lot of bank holidays and weekends to include. We're right on the front line of the NHS and patients and relatives often look to us for comfort and support. You have to know when you can handle a situation or when you need to involve someone more senior. No two shifts ever the same. You could be working with different patients and a different team each day. A patient who was well one day may be quite poorly the next. You need to work as part of a team to ensure that the shift runs smoothly and that the patients receive the best possible care. There's a lot of paperwork that needs to be filled in. You need to ensure that this is done accurately, and you also need to be quite good with numbers. A mistake could be really dangerous for the patient. Communication is key. You have to involve patients and their families in the decisions made around their care. You also have to communicate well with doctors, physios and other members of the multidisciplinary team. Another part of the job is supporting patients' families through difficult times. The nurses need to be able to rely on you to pass information on really quickly, as this can literally be a case of life or death. You could work with adults, babies, children in ward areas, theatres, outpatients, urgent care units and the intensive care units. We have over 120 different wards and departments covering different specialities, and we see roughly around 1.5 million patients per year. It's a huge organisation which can take some getting used to. We have a major trauma centre, a cancer centre and a children's hospital, amongst many others. A typical shift for me starts in handover. You need to know details of the patient and what they need from us to look after them. We also assign teams so we know who will be looking after each patient, but that doesn't mean that we can't help each other out during the day. At the end of the day, we're all here for the same reason, and that's the patient. We introduce ourselves to the patient so that they know who's looking after them and let them know what's happening with their care that day. You might be asked to escort someone to X-ray, help with meal times. There's definitely a lot of cleaning to do and helping with personal care. It all depends on which area you work in. I definitely think I make a difference to patients by being polite, friendly and showing that I care. The patients are in a really vulnerable position and any tiny thing that you can do to make them feel better is worth so much. The advice I'd give to anyone wanting to work at Leeds Teaching Hospitals would be that it's hard work, not always glamorous, and it's a lot of responsibility. You have to keep up to date with training because people genuinely rely on you. But if you're caring and hard working, it has amazing rewards. I go home knowing that I've helped people. Not every job can give you that. You have to be prepared to work unsociable hours and deal with difficult and upsetting things. But if you can do that, it's a fantastic job. And it doesn't have to stop here. There are opportunities to further your career at the hospital if that's what you want. You can train in-house to be a senior clinical support worker or learn specific skills like blood taking or putting cannulas in. And if you want, you can go on to access university courses to become an assistant practitioner or, like me, go on to do your nursing. Once I've qualified, I'd like to stay here as a staff nurse at Leeds Teaching Hospitals.